What's going on, guys? Dr. Ryan Hewitt here, and we are in my exam center here where I do all of my consultations for new patients and re-exams. What I'm going to do today is I'm going to demonstrate 8 of my fundamental functional movement assessments that I do with all of my new patients. Now, by no means are these the only ones that I do. These are just a lot of the sort of big global functional movements that I look for to see if there's any breakouts that I need to do if I'm noticing dysfunctions with the movement. Now, what I'm looking for in these tests is either A, pain, that's indicative of pathology, or B, I'm looking for any dysfunctions with the movement, meaning they're unable to perform the task with relative ease, or for seeing any specific aberrations of movement. So the first one I'm going to do is just a simple range of motion with lumbar spine, okay? So it's a bend forward test, bend over, touch toes. What I'm looking for is roundness of the entire back, so your lumbar spine and thoracic spine are able to flex. Second, I'll do a feet together, okay, extension, looking for the hips to push forward and the entire back to arch. And of course, I also do rotations, lateral flexions. So that tells me all about the lumbar spine. Next, what I'll do is a single leg stability test. We'll get the knee up to 90 degrees, and I look for the patient to be able to balance themselves with relative ease on both sides. If we see any indications of being real wobbly or whatnot, we'll suspect maybe something going on with the foot, ankle, maybe hips. Then I'll do a lunge test. We'll start with the feet together. We'll lunge forward, tap the knee gently, and step back. Should be able to do that fluidly, both sides. Okay? Keep in mind, I always do these assessments with no shoes on because we're looking at the function of the feet and toes as well. Then we'll do a deep squat test. We'll point the toes forward, feet shoulder width apart, and we'll have the patient squat all the way down, all the way up. We'll look for the torso to be able to stay upright, feet flat on the floor. We'll look for any feet spinning out, shifting to one side or the other, etc. I also have this PVC here to do a quick shoulder rotation test. I'll have the patient grab it real wide and with straight arms be able to pass back and forth like that. Usually means the shoulders are pretty healthy. Then I'll put the patient on their back. We'll do a couple core stability tests. The first one is kind of a zombie sit-up. We'll look for the patient's ability to sit up with relative ease and no pain. Then what we'll do is we'll look to check to see if the patient can brace their core properly. Okay, lifting the feet 6 inches, being able to brace the core, pressing the low back into the bench, and holding for a count of 10 seconds. We'll do a straight leg raise test, test the posterior chain mobility, right? Want to be able to get that leg all the way up to at least 70, preferably 90 degrees. A lot of times I'll check the hip mobility at that time too. And lastly, we'll do a hip extension test. Laying face down, we'll extend the hip up, straight leg, looking for the glute to activate in sequence, making sure we get at least 20 degrees of extension. So there you go. There's a real simple functional movement assessment. That's what I'll use as my base assessments, and I'll break out if I see any dysfunctions from there to really identify the problem. So, see you guys next week.